All right, everyone, we're going to be starting, and just want to thank you, everyone, for joining us today. Hello, gentlemen. Well, find a seat. There's 2 seats here. If you want to fold them up and bring them in the back, whatever you want. Okay, so we're going to start off the meeting today, and we're going to do the Pledge of Allegiance. So if everyone could rise, pledge to the flag over there. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much, everyone, for joining us today. This is our first in-person meeting of the year with the Brooklyn Tea Party. We were doing Zoom meetings throughout the course of the year, and we thank everyone who joined us live or who joined us afterwards in watching the videos afterwards on our YouTube channel, on the Brooklyn Tea Party YouTube channel. So we'd like to extend, if you could pass that along to other members. This meeting will be uploaded to our YouTube channel, so you can watch it later on and also share it with other members or friends that you have. So we appreciate your support. Once again, if you are looking to become a member of the Brooklyn Tea Party, we are accepting membership now for 2022, or if you'd like for 2021. This is to ensure that our organization can continue. It's been around since 2009, and since 2009 we started on tax day, April 15th, 2009. So we've started then. Hello, welcome, you could join us. If we could get some seats together, maybe. One here. Hello. Maybe we could yeah, we can move over and then we have 2 together. We have 2 seats here if you want. Okay, great, thank you. Okay, yeah, that will work. You want to, David, you want to maybe that seat and then they could get this. Okay. Thank you so much. There's one more right here, ma'am. You could sit here, or if you want a seat back there, it's up to you. You want us to? Okay, thank you. So, I want to thank everyone who is new that joined us today. Like I said, this is being filmed and will be put up on our YouTube channel. So we thank everyone. But without further ado, I would like to introduce our candidate. The original speaker, Menachem Ray-Poit, couldn't make it. He had a family emergency. So we were so fortunate to have our public advocate candidate for New York City, who would be second in charge of the city. That means when the mayor leaves, not the deputy mayor takes over, but the public advocate takes over based on city charter and city constitution.
Jemani Williams is the guy.
Well, hopefully not for long. Hopefully she will be our next public advocate. So without further ado, I would like to introduce you to Dr. Devi. I'm going to butcher your last name.
Don't even worry.
Thank you.
In person. So I'm Dr. Devi Nampiaparampil. Most people just say Devi or Dr. Devi, you know. So on the ballot, we're actually fighting to add the doctor just so people can recognize it. I mean, in a pandemic, I think a lot of the things that we're facing, not just medical, but in terms of all the laws that are hurting small businesses and hurting people, I think people are using, our lawmakers are using medicine to polarize the people, divide our city, and hurt the city. So I'm fighting to actually have that added to the ballot, so hopefully people can recognize it and we can use that to at least get elected and have some, have some reason kind of put back into our laws. I think what's hurting us the most isn't actually the virus, but the fact that these laws are turning New Yorker against New Yorker. What we have right now is a situation where people are being turned against each other, vaccinated against unvaccinated, tenant against landlord, employer against employee. It's just nonstop, and that's what's actually hurting us the most. So I have actually done a meeting with Glenn and Larry for about 2 hours. That's already online, but I wanted to come kind of talk to everybody in person. I didn't know how much time I have. Oh, okay. So I figured I would try to answer as many questions as I could. I'll say first, I think what's hurting us the most right now is this vaccine mandate. So I'm not sure what all of your thoughts are, but for me personally, I think there's a few things about it. First, I think personally, this is an issue of freedom, that people should have their own choice, you know? I mean, in terms of the vaccine, okay, it seems to be protective for a lot of people, but nevertheless, you know, nevertheless, it should be people's choice, right, what they do. So that should be up to them. Second, in terms of how it would affect our economy, so here's our problem, that if the government was going to do it, it's one thing. Again, I'm against it, but that would be one thing. But instead, they're putting it on to the small businesses. So what are people supposed to do? Either way, the small businesses are going to be harmed. Because if they're trying to enforce it, which I don't think they should, but if they're trying to, how are they supposed to do that, right? They're going to be harmed even with this, because they have to either fire their employees, if they're small business owners and they're against it, what do? Their customers, they have to turn their customers away. No matter what they do, they're harmed. And then if they don't enforce it, the city's going to come after them, they're punished, they have all these fines, they have all these problems. So either way, they're screwed and they go out of business. On top of that, then you have, you know, not that I'm for the corporations, but you have things like healthcare, you have the city infrastructure, you have all these other businesses and institutions that are harmed as well. So even in healthcare, you know, I've had people, physicians who call who say, like, I don't know what I'm supposed to do, you know, I've already had COVID, because a lot of healthcare workers have had COVID. They have natural immunity. They say they have absolutely no benefit in their minds from getting this vaccine, but they might have a risk, and so they don't want to get it. But, you know, if they're going to be fired, then what will they do in terms of taking care? What will the city do in terms of taking care of people with heart disease, cancer, all the other medical conditions? And people have waited for a year and a half, 2 years to get these things treated. So you're going to have people coming with cancer at later stages. Everything's going to be worse in terms of people's medical problems. And they're coming to the hospital at a time where we're already short-staffed, at a time where people who work at the hospital have had a harder time. They don't have child care. They don't have care for their sick and elderly parents. They don't have care for, like, their loved ones. People are really burned out, and then you're going to fire all these staff to begin with because of this mandate. I mean, the whole thing sounds crazy. Now, I'm a healthcare worker, so I know about that problem, but imagine that happening with all our other services, police, fire, everything. The whole city will collapse. So I don't really understand what kind of strategy this is to help us as we're kind of coming out of, you know, all of these consequences from both the virus and all of these lockdown and other measures that have hurt the city just as much, maybe more, from trying to address the virus. So I feel like we're not out of anything. We're kind of still in a crisis mode, perhaps from all these mitigation strategies and stuff. So I feel like things are terrible, and what we have is leaders who either don't have the knowledge or the skills or the empathy to actually address this problem. And you know, for me to run, I'm not a career politician, so it's not that I just decided, okay, let me keep running. It's that I was in the midst of this, working throughout the pandemic. You know, I sent my child away. I love my child, but I sent my child away for 8 months because when the virus hit, I'm not somebody who stands there complaining about problems. I actually try to solve the problem. So when the virus hit the city, I thought, you know what, people need me. I don't treat COVID patients. I treat disabled people. So I treat people with cancer, HIV, people with spinal stenosis. I used to treat for years people returning from Iraq and Afghanistan with combat-related injuries. I'm a pain physician. So basically, you know, I treat people with catastrophic injuries and chronic pain. And, you know, what happened at that time was the city said, not that I expect all of these things, but if you shut down daycare schools, you shut down everything. You know, I have a small child, she was 2 at the time. I said, you know, I have no options for childcare right now. I'm not sure what I'm supposed to do because the patients need me. Like, cancer didn't go away, these things didn't go away. And so the city said, well, we're only providing these services, we have them, but only for people taking care of COVID patients. So I kind of had to decide, like, I could stay home and take care of my child and, you know, we could be together, or if I did that, then what would happen to patients I took care of? So in that one, like, moment, I kind of realized if I do that, the patients will survive, like, maybe for, like, a few days like that, but then they'll have to go to the ER, they'll have to go somewhere because they're going to have this problem, like uncontrolled pain. That's why they came to me as a pain physician instead of their regular primary care or oncologist or whoever treats them. And if that happens, they go to the ER in the middle of all of this. It's like a death sentence. At that time, it was like a death sentence. So I decided, you know, I have to send my child away because this is unacceptable. So I thought that she would be gone for 2 weeks. She was gone for 8 months. And throughout that time, just seeing nonstop all the problems in terms of the city's management. And the more I started talking to people when I decided to run, the more I saw that this isn't just like a new or isolated problem. This is the way it is in all these different fields, small business, the construction industry, like the restaurant industry, everything. The same types of problems that I've had that I thought, well, maybe it just affects me, like in terms of getting permits or these inspections in the middle of a crisis. You know, we pass the inspections and I've never had a violation, so I'm not complaining for myself, but I thought, this is weird. Why are we having an inspection in the middle of a crisis when we're short-staffed and we're trying to save these people? What's going on? Why don't they ask us if we have problems and try to help us? But, you know, I started wondering what kind of mentality do we have in the city? So I think these are the problems that we really need to address. That's why I'm running. And just so that you know, I am the Republican nominee, so there is no other Republican running against me, you know, and I think it's time to really, you know, work to change the mentality of the city. We have a winnable race. So the reason I mention a physician is you don't have to be a physician to run, obviously. You don't have to be a physician to understand there's something wrong with the mentality of the city and there's problems throughout the city government. And it comes from the top down. So the reason I mention it is because in order to win, we have to convince independents and Democrats also to vote for me, right? But I think this is a time where they would, because, you know, they also are seeing between de Blasio and the Thrive NYC, you know, with Cuomo and everything going on, Biden with Iraq and Afghanistan, Iraq first, but Afghanistan especially recently, you know, what is going on with the policies? So I think with a winnable race, now is the time. And, you know, my opponent, Jumani, is talking about running for governor. I don't really even understand what's going on there. So, you know, so I'm asking for your support. I want to have a debate with him, but he has not agreed. So the only way I can force a debate legally is by reaching the matching funds, or the requirement for matching funds, which this is campaign finance law, which I'm learning that you have to raise a certain amount of money. When you hit that threshold, then there will be a forced televised debate. So there are basically unions that usually support Democrats that have said that they would support me because also being a healthcare worker and all of these things, they would actually lean towards supporting me, but they don't want to do it unless they think that I have enough support and I would get the matching funds and I would have the televised debate, because they think if people see us side by side, people would vote for me. But if we're just sort of like nebulous, nobody knows what public advocate is, nobody knows who I am, nobody knows exactly what's going on. If people go to the polls and they have no idea who I am or what a public advocate is, then what happens is people vote by party. And because Democrats outnumber Republicans, then people will just vote for the Democrat on the ticket rather than the Republican. So what I'm focused on is to try to raise that matching funds. But it's not because I'm insensitive to people's financial situation or the crisis. It's because this is the campaign finance law, and I'm not allowed to just put my money in. There's a limit in terms of how much an individual can donate, even if it's a candidate. So that's why I mentioned all of that.
What is that number?
For an individual, it's $6,000, but for the debate, it would be, for matching funds, it's $125,000.
You have to raise 125.
Yeah, from New York City residents, yeah. And then it's from 500 people. So basically, I've raised from 150, or it's almost 160 people, but it's by a specific deadline, so 160 people is.
That could be a wife and husband?
Yeah, so it's actually, if there's a couple, it's actually better if the two people donate separately than one person.
Can you give money to somebody, like say I want to give some money to one of my kids or something like that? Can they give it to you or that?
Well, you can't, technically you can't give it to your kid, but your kid can donate, yeah.
Your kid can do that.
Yeah. Unless it's actually under 18. I mean, it has to be
I
somebody.
mean, like over 18. Like
Yeah,
you
over
can give
18.
money to someone. Yeah.
Well, you can't give it.
Can't say it.
Can't say give it to them and do it.
Well, what you do is your own private.
Wink and a nod.
Well.
Maybe he cleaned the house and he earned, maybe they earned it.
Yeah, right.
So everybody has to give like their own money, you know, they have to give their own money and donate, but anybody over 18 can donate who's a citizen or a permanent resident, but yeah.
What can I do? Because you're terrific.
Yeah.
Oh,
very
thank
good.
you, thank
Really,
you.
even more.
Oh.
almost as good as Tucker Carlson.
Oh, thank you. I've been on
I
Tucker.
saw
I've
him.
interviewed Tucker Carlson before too. So I'm actually so I was a Fox 5 medical contributor for years, and then I've been on Fox News and Fox Business and stuff too.
Dr. Oz, right?
Oh yeah,
You've
yeah.
been on Dr. Oz.
So on those things, my makeup has been better.
The heat here, right?
Well, no, so I did this myself. The people at Fox are much better.
No, you're fine.
But
So what can we do to help?
oh yeah,
promote
so
you?
what I'll do is well, I have two things. So I brought the check contribution cards, but ironically, not ironic, but if the handwriting has any problems, then the CFB can give us a hard time about that. But I can pass those out, or if you don't mind giving me your numbers, we can, whatever's easiest. We can text you the link, or we can email you the link, whatever's easiest. Because the link is a credit card contribution, which might be simpler, or simpler meaning if it goes through the credit card platform, then what happens is the CFB doesn't question anything. But otherwise, I can give you the check contribution form, which you could either, I don't know if you have your checkbook, so you could either give it to me or you could mail it in, but I don't want you to have to go through trouble with that. I can, we have stamps and everything. I just don't.
And I'm saying those are I'm poor. I'm not proud. I'm poor, but not proud.
Well, whatever you could give.
Yeah,
$5,
even-
$10.
even $10, anything, yeah.
What can I do to promote you?
Oh yeah. So if you give me your email, then what we can do is we can also send it, even if you could email the link to people that you know, like with our website and the thing. Because the thing is, it all adds up. So if we hit the number of people, that will make a big difference. Because what happens is, if we hit the number of people, then we've met the first requirement. So then people who, there are donors in New York City who have more money, right? I mean, but if we've hit the first requirement, it's easier to pressure some of the Republican Party leaders to help us meet that second threshold. You know what I mean?
That shows you that if he doesn't want to debate you, that
Yeah.
means he has something to hide.
Oh,
I
yeah.
met him. He's
His
a
record. He
nice
should be
guy.
hiding from his record.
Well,
Yeah.
yeah, his record is zero.
Exactly.
Yeah, because I think what's happened is they feel none of the Democrats actually have wanted to do that before. They just, if they don't have to debate, right? 'Cause
Right, why chance it?
yeah,
It's rigged.
yeah. So yeah.
Aside from being an advocate for medical situations,
Oh no, not just medical. All the,
what other
yeah.
what other things are you striving to advocate
Yeah,
for?
well, so for all of this, so even, let's say Thrive NYC, right? So public advocate, the way it's kind of described, or at least the way Giuliani and other candidates have talked about things, is as though it's like, oh, let me stand from the bully pulpit and talk about what's wrong. I mean, you can do that, but I kind of feel like that just makes it sound powerless. I mean, I can do that even now. Like when I was doing things on these networks, I could do that. I didn't have to have a city position for that. But the public advocate has other things they can do. So they can write laws. Can't pass them because they're city council, but you can introduce the laws. So what I would say, besides that, I mean, to get to your question, they can also publish the city's budget. They have the ability to publish a data directory in terms of all the city's data, right? So what I looked before I ever decided to run, I wanted to know, okay, well, what's going on in the city, because I don't really understand, where is the money being spent, and even trying to figure out all these things, like what's happening with daycare, what's happening with anything over the past year, right? It's almost impossible to figure out anything. There's a lot of stuff on the website, even in terms of figuring out all these rules and Department of Health stuff, just so I could comply over the past year. Almost impossible to try to figure out what's happening, right? So the public advocate has the ability to do those things, but hasn't published any of this data directory stuff since 1993. So this idea that the public advocate can do stuff but doesn't, and then nobody questions it, is very strange. So let's just take this example of Thrive NYC, for example. So putting aside any medical knowledge, just the way a medical practice is run, like if a patient paid a copay twice, I know about it in our practice because, somebody's going to say something, either the patient, the biller, the insurance company, it will come out, and then we've had, in a 6-year practice, like my private practice, we have made 5 errors. We have thousands of patients, by the way, okay? So we have made these errors that handful of times, and I know about it and personally apologize to patients, right? But in this city, we have lost track, and that was like maybe a $20 copay. But in this city, we have lost track of $1 billion We don't even know. And,
What would you advocate saying?
yeah, that should be
solution
transparent.
To not giving